Hi there, it's Justin Lubino with Senior Advisors. If you find our videos helpful, I'd appreciate if you subscribe, like the video, comment on the video. It helps other folks get to see the great content we provide. Now, we're in the midst of annual enrollment for the upcoming 2024 plans. Very busy right now, but just had to take a moment here to share some updates over the last couple of months that have come out related to something that's very important for folks on Medicare. And I titled the slide 99% versus question mark. Well, what are we talking about? We're talking about provider access. So provider access is the ability to see the doctors and hospitals you'd like to go to for your medical care. And with Medicare, there's two different options. You have original Medicare, which generally gets paired with a Medicare supplement. And you also have Medicare Advantage, okay, which is the fully privatized plan where you can get fully administered by an insurance company. Now, we offer both of these paths for people. If they prefer one path over the other, we certainly can help either one. Nationally, it's about a 50-50 split right now between Medicare Advantage and Medicare supplements. However, our clients' base is roughly a 90-10 split, with majority going with original Medicare. And, we do offer, like I said, the Advantage plans. Now, why is it such a heavy split? Well, this is one of the most important things for our clients, at least, is provider access, the ability to go to the doctors they want to go to, the hospitals they want to go to. And with original Medicare, there was a report last month or about 2 months ago from a Kaiser family, which indicated 99% of providers are still accepting Medicare. So pretty much every hospital in the country and about 99% of doctors accept original Medicare. So if you go with original Medicare with the Medicare supplement, you can still have all that access to those providers. There was also an article last week from the USA Today talking about Medicare Advantage and certain big hospital systems that are basically just dropping out. No longer participating with Medicare Advantage plans. The article specifically was talking about some providers in Ohio, Virginia, California. But the bottom line is it's pretty much an uncertainty. If you're in an Advantage plan, you have to go to certain providers that are within that carrier's network with the Advantage plans. So, and I just want to show you an email, actually, I just got as well last week from a new potential prospect. I tried to block out a lot of the identifying information. So you see those white blotches all over. But essentially, the woman says she's been on a Medicare Advantage plan with a carrier in a state since 2020, when she became eligible for Medicare when she turned 65. Now, the program is no longer accepted at her provider, which she likes to use. She wants to stay with that provider. She's been with her doctor for many years, who's younger than she is and not retiring anytime soon. And then she provides information about her husband, who's been with another carrier on an Advantage plan at the same provider that they're using. And she can't recall how many years. His doctor is part of the provider as well, but the cardiologist doesn't accept the plan, so he's been paying him out of pocket. They both reside full-time in a certain area, and that provider will no longer be accepting Advantage plans. So they have to make a change, and they're both in very good health. So this is an example, right? They've been on Advantage plans for a few years, and they're looking to be able to continue to go to their provider, which is no longer taking Advantage plans. Now, probably the most important part of this email is that very last sentence. We are both in very good health. Why is that so important? Well, in order to get back into original Medicare with a Medicare supplement, they're going to have to go through medical underwriting. So each carrier has about 10 to 12 different knockout questions. If any one of those is a yes, they won't even be able to submit an application for a supplement. So this particular individual and her spouse will most likely not have an issue because they're in good health. But if you have major health issues and you're in this Advantage plan for a few years and then you want to go back to get a supplement, you probably won't be able to do that. So when people first sign up, we always tell them, look, this is a lifetime decision. Because of that medical underwriting, you may or may not be able to get into a supplement in the future. So just something to be aware of. Now, we have another video out there that explains all the differences high level between Advantage plans and supplements. So I'll link to that here so you can see that. But I just wanted to highlight, since this is relatively new news related to these providers and the issues that are going on, so you're aware of that as well. We have a bunch of other videos out there. You subscribe to us on YouTube, share our videos so other folks can see it. We'd appreciate it. and hope everyone has a great rest of your day. Thank you.